So that was kind of the situation for me, was to kind of go through that process of seeing like the high, six-figure income and like working inside of a corporate environment where it was becoming more challenging and it was um, more becoming a bureaucratic, environment, and less driven by excitement and enthusiasm and trying to change the world, more about expenses than growth, and being in sales and revenue. I started feeling like that pressure and the kind of I don't know, the motivation and ambition to try and do something different.
Yeah.
That being said, obviously we'll get more into Tikva, but I started, seeing some of these problems too that exist in the health and health insurance space,
Yeah.
that we're trying to kind of solve for as well.
Yeah.
So,
Yeah. Very cool. Well, in full transparency, and I've been, uh, you know, in developing this podcast now in our fourth year. I said it earlier. I mistakenly said it was our third year because I'm having so much darn fun. But in our fourth year, I've made a lot of mistakes because I started this podcast really not knowing what I'm doing. And I've had great guests. You're part of the family now, right? Of great guests, but a lot of great guests who've just been gracious and patient. And I've kept my integrity every step of the way with the podcast, and I've said on many occasions in the early days, I said it every time, that we tend to stay away from politics and religion because they seem to be polarizing, and I'm not sure if it really moves the needle to debate religion and politics. I'll throw sports in there too for all the non-Tar Heel fans. But anyway, I'm curious. I think of you, I perceive you, I see you in a light of faith, and I'm curious how that faith that you have, that you hold on to, how it affects what you do in business and some of those decisions that you make.
another excellent question, man. And I'll tell you what, I believe I mentioned earlier, I do have like my faith is really most important, number one. So it's funny, actually, even just this morning, kind of processing through both personally and professionally, it's a grind as building a brand new company. And so trying to um, put my faith first in every single little decision that's made. So, we can have I can have the direction that I need and the prioritization that we need and the stewardship, and the smart financial decisions, that we want to make with the company. Um, and I'll tell you, even like the word tikva is hope, in Hebrew. And so, our company is really built on hope. So it's interesting. I think even for me, probably like the last 4 to 5 years, Chuck, I would say that I kind of shifted away from having a fully, kind of like way of looking through a physical lens in the physical world of sorts,
Mhm.
and started really appreciating bringing my faith and my spiritual perspective to things as well. And I'll tell you, as an early stage, entrepreneur,
Yeah.
there's no way through it. There's no way, other than through it. You can't get around, this because you've done it. You mentioned earlier,
Yeah.
in regard to, you know, the beginning phases, and you've been a big inspiration to me personally, just through some of the stories that you've told. But that has been a incredible daily factor for me to be able to continue to press forward, in doing all this and also every other area of my life as well.
Yeah. That's cool, man. Very cool. Well, one other quick personal question, and then I want to jump into what you are doing at Tikva. Okay. If in my audience over these now going into our fourth year, not third year, but fourth year, we've just grown together. We've grown up together, in these conversations, and it's been so cool to get feedback. And um, I had this is a sidebar, but I think germane to the comment that you just made. I had a guest on, I think in season two, and it was a wonderful conversation. Um, very large. a lady that works for a very large German company who is since been has become a really good friend of mine, and we had a conversation, and it took a turn that we did not expect. It went from a very high level business, huge, massive company, and just talking about what they're doing in the marketplace and all that kind of stuff, into a very personal and vulnerable um, area in that conversation. And we didn't know that it was going there, but it did. And thank God it did, because when we aired the podcast, one of her former coworkers reached out and said he was at the end of his rope and had been thinking of the worst, the inevitable. And by listening to that very open, transparent, vulnerable conversation, he found hope to continue on with his life and his business and his marriage and his family. And that's life changing, bro. That's life changing, Um, so the personal is really important to me in any conversation, particularly in this conversation, because our whole premise of the show is built on real and raw conversations. But so my question before we get into Tikva is this: if you could ask one question to anyone in the world, and it could be any question, who would you want to ask that question of?
Oh my gosh, man, that's a tough one.
And
Um,
you did not
but
have
I
the
got to go
question
with,
ahead of time.
hey, you know what though? You're gonna like this, and this guy's been on my mind, I think, quite a bit. But former North Carolina Tar Heel,
Mm.
six-time NBA champion, Michael Jordan,
Oh, nice.
and and I think for me, the question that I would ask him would be, people often sometimes look at they look at like they go to the games and they see the glamour of the games, and they see like kind of like the like what you talk about, the pinnacle, like the rise or whatever. But I'd really be curious to see what it really took back in the late 80s and early 90s to kind of set the tone for what they accomplished with
Yeah,
the Chicago Bulls.
yeah, yeah, yeah. Well, listen, great subject and great question. Way to go, man. That's awesome. Yeah. He would actually hung out on his boat one time. Um, he was not there,
Oh my gosh.
and I was not supposed to be there. We'll leave it at that. But yeah, that's cool. So let me ask you. Let's jump into Tikva health and wellness again, just to set the stage. Right, you left a great job, lots of security, good income. Life was clicking along, doing well, and became disruptive. You became disruptive to an industry that does not like disruption. It's just not prone to being picked at, right? And you did it. So I applaud you for doing that, for having the wherewithal, um, the faith and the tenacity to challenge the big old giant gorilla. Um, so I love the disruptive nature of Tikva health and wellness. What was the problem that you wanted to solve there?
You know, it's interesting because being in the insurance space for 20 years, it's what happened and what kind of led me to the vision of beginning this company in the first place was, we had some personal life situations that hit us, that um just started causing, some concerns and some questions. And I'll share a couple with you. The first one is Chuck is my oldest. There's a lot of ADHD diagnoses that goes around, these days.
Right.
And, you know, he's 17, almost 18 and thriving now. But when he was 5 years old, he was diagnosed with with ADHD. And we just didn't feel super great with the one solution of putting them on a prescription drug, you
Mm.
know? And so my, my ex-wife and myself at the time, um, went down the path of trying to look at like maybe an elimination diet and maybe looking at, maybe some chemicals and different things. And we found that we worked with a more naturopathic provider, and it was a short, shift and change that he was able to, reduce some of those symptoms and get back to feeling whole and being able to see kind of what caused him to get out of balance in the first place.
Yeah.
And we had to pay for that out of our own pocket.
Mm.
Um, Another more drastic one is like after my third son, my third child, my son Christian was born. Um, my ex-wife Amy had postpartum cardiomyopathy.
Mm.
So what that is she had congestive heart failure and had a really bad battle and was having some heart issues and really had a bad prognosis from some of the heart surgeon as well as cardiologist and different people that they're kind of looking at what she may have to look at dealing with for the next 5 to 10 years, maybe forever.
Mm.
And we found a functional medicine doctor in Texas that helped her get her hormones and adrenals balanced. And she was back in the office of that cardiologist doing a what do they call it, like ultrasound or heart,
Mhm.
and he didn't even know what to say. Like her heart had been healed,
Wow.
within probably less than 6 to 9 months.
Wow.
And so again, we had to go and look, through some of these different alternative solutions, and we had to pay for all that out of pocket,
Mm.
and we had to, go about it, on our own investigative journey. There wasn't a lot of support because the healthcare system can be so heroic in many ways, but it's focused on biomedical type. This, you spent a lot of time there.
Right.
It's built on pharmaceutical studies and it's driven more in, in the classroom and in that type of environment than it is out in the world.
Yeah. Yeah. You're creating, you're driving this paradigm shift again in the health space. You're sort of tackling insurance as we know it, right? What's been the biggest challenge, David, in being disruptive?
That's a great question, Chuck. I'll tell you the biggest challenges when we think about paradigms trying to be shifted is that we all kind of grow up, as we build up our own perception and our own experience of the world. And so, that can often limit our ability, to see things a little bit differently or even be willing to evaluate and try things
Mm.
that might, work better or a little bit differently. And so one of the biggest challenges I see right now is that we want to make a huge contribution to helping people find a healthier way forward. But at the same time, with the healthcare system itself, there's so many trained professionals, like different actuarial science, where we want to try and make an impact with trying to build pricing and rating, a little bit differently than it's been done before. um, Care modalities. There's a lot of different things that we're super comfortable with, that unfortunately anything that falls outside of that gets scrutinized and
Mm.
gets looked at a little bit differently. So it's going to take us some time, to be able to make an impact on both sides, because there's the professional side and there's also helping people back to that kind of that early experience, becoming more confident and maybe a little bit more willing, out of fear to take a step in a different direction that might lead them down a better path,
Sure.
for their health
Yeah.
and just some of the traditional, just situations that continue to pop up with pharmaceutical drugs or often sometimes, other types of treatments and whatnot that tend to be a little bit more invasive immediately. I mean, a lot of times there's certain things that are necessary, in time, and conventional medicine can be, again, it can be amazing, but we always start there, and we're reactive and we're also symptom focused.
Yeah.
So
Let me ask you, just so we have a good understanding of what you guys are doing at Tikva, right? Like we have a big old group policy insurance policy, and having having just been through